We all come from different part of the world, so definitely I need to talk something about the global air quality. So actually this picture comes from the air quality of the whole world. It is a kind of real-time air quality map. I captured it a few days ago. So basically you can see green color is much better, and then red color means very severe pollution. So you can see that the very polluted area is in the Southeast Asia. And in particular, I'll talk about China. So when you think about China, your first impression will be like this, with a lot of agricultural and also rural area. But then after years of development, you can see that it became modernized. This is Beijing, this is Shanghai, this is Hong Kong. So to become modernized, of course there are a lot of drawbacks and we need to pay a lot for that. So that means this is a nice picture of Beijing. But then this is also the same picture from Beijing. But we capture this picture on the other day, which is a highly polluted day. So that's why I say we need to pay for it to become modernized. So become modernized because of the building of the factories, car exhaust, power plant, indoor cooking, all these contribute to the very significant air pollution. And of course, in China, smoking is also one of the main factors that lead to the problem of COPD, and especially this kind of unwanted effect. If we talk about the prevalence of COPD in China, actually the prevalence rate falls within the pooled global data, which is about 10.1%. This study was conducted in 2007 in different cities in China, and then the prevalence rate actually ranged from 6.5 to 13.7%. And if you look in the details of the data, you will see that the percentage in rural areas is actually higher than that in the urban areas. When we talk about smoking in China, this is a project conducted by the Global Adult Tobacco Survey. In particular, the Chinese Center, they recruited 13,355 participants. And they found that among these participants, 28.1% smoke. Predominantly is male and middle-aged, rural area, more people smoke than the urban area, and particularly in the west region. A lot of people reflect that they didn't know the bad effect of smoking, but very likely it's influence of the peers, influence from the drummer, so that may also explain. So this one is a study conducted in China again, and then they try to find out the prevalence rate of the mortality in association with smoking. Of course, as every one of you know, that is a kind of dose-response relationship. When you smoke a lot, definitely the mortality rate increase. This is another study by Berendt in 2015. It shows that the ranking of the air pollutants in different countries and cities. And again, Beijing popped up the top 10 cities who have the highly polluted area. This is another picture that I captured from the Chinese website. So it's a kind of collaborative work between the US and also China. And then they monitor the PM 2.5 level in different cities of China. And of course, they are given different ranking. And again, you can see from Beijing, Guangzhou, Chengdu, and also Shanghai, Beijing, also the top one with a very unhealthy level. How about in Hong Kong? Well, our level probably just half of the level that is recorded in the previous 4 cities that I mentioned, probably be associated with a smaller population size and the less amount of the factories being built there. As I mentioned, Beijing is quite highly polluted area comparatively. So you can see the 2 pictures. This is the National Stadium where the Olympic Games take place. And in the past, same location, but you can see huge difference in the pictures. This is a day with highly polluted day with a lot of smog. This one is our Forbidden City, which is very famous sightseeing places in Beijing. And you can see huge difference. That is a highly polluted area. So other study also tried to investigate what could be the air composition in Beijing. So even in Beijing itself, they collected the air sample from different places. And what they found is actually level quite similar. In winter time, the concentration is much more than the summertime. And in particular, most of the pollutant is related to the car exhaust. So in view of this, what could be the potential preventive measure or the medical management? So actually this picture, this information is collected from, is extracted from WHO related to the China's information on cigarette smoking. Right now, more and more places have been put on the smoke-free legislation, particularly in the public transport. And of course, in the tobacco packages, they have the healthcare warnings, anti-tobacco mass media campaigns, and then also bans on the direct tobacco advertising, promotion, and sponsorship. So all these try to prevent youngsters or prevent people to no smoking, try to help them to quit smoking. So these are the pictures that I captured from the campaign about anti-smoking on the World No Smoking Day. Of course, Chinese government also have a lot of measures to help. There is a China National Environmental Monitoring Center. They also monitor the air quality of the 5 major cities with different grading. So of course, when you know the grading, it will be translated to some meaning. So if it is a moderate, it will mention that usually unusually sensitive people may experience symptoms, and those who are unhealthy for sensitive groups, then especially those with lung disease or cardiac disease, then they may need to be careful and not to do any prolonged exertion in the outdoor environment. So of course, in Hong Kong, we also have similar measures that we have the website, and then we have the air quality index pop up in the TV, and it's to let the patients or let the audience know that what will be the air quality and what will be safe or not safe to do the exercise outdoor. Again, China. So in the highly polluted days, you can see that people try to do some preventive measure. They wear a mask. Even this doggy is wearing a mask to prevent the air pollutants. So people waiting for the public transport, most of them, no matter which age they are, they also wear a mask, even kids. You can see that. There is really a huge market for masks. Different style of mask. Very funny faces, funny style, different patterns. So it also highlights how polluted the area it is, so people really want to do something to protect themselves. So this is the medical, the hospital in the rural area of China. Even though we mentioned that China got a lot of urban cities, but still some rural areas. This is the pictures that is taken from the hospital in Hong Kong and in the modern city in China. This one is taken from the Chengdu. So why I want to highlight this is actually the medical system is quite different from Hong Kong and China. For Hong Kong, citizens just need to pay a fixed amount in hospital daily, and that includes all the medical expenses, the expenses of physiotherapist, and the price is the same for different public hospitals. But for China, the price will be different. And sometimes if you do the rehabilitation, one item or another item, the prices will be different and may need to add it up. So if we talk about the medical system, there are different classes of people in China. They are having different kind of medical insurance. But right now, China's government have put a lot of resources in helping the people, and especially increasing the subsidy to people who are the farmers and also the other sectors. So this also help people who have the problem. So regarding the concept of rehabilitation, I should say that probably 15 years ago, people in China, they only have the rehab therapist, but they did not have very distinguished type of physiotherapist, occupational therapist, or speech therapist. And especially people in China, they have a concept that I pay, then you need to do some therapy for me. So we're doing some passive stuff. But I think, as you all know, active exercise is very important. Keeping your body active is very important, especially in the management. So it is very important that we need to give the concept of active exercise and then train people to do more in the rehabilitation process. So actually our university have helped to set up the Master of Physical Therapy program in China so that we can train physiotherapists and to promote the rehabilitation. Of course, as I mentioned, rehabilitation is just a new start in China, and especially for the pulmonary rehabilitation. So we work closely with the Australian Lung Foundation. We help them to translate all the online platform about the pulmonary rehabilitation toolkit, how the therapist could set up a pulmonary rehabilitation, how the patient could know the idea about education and know the idea about the lung disease. And we also help them to translate a booklet that is Better Living with COPD. We want to let the patient in China have more chance to get the knowledge and to understand the disease and how they can work well with the therapist. So we also want to see if there is anything East and West could meet together. So as you all know that acupuncture and Tai Chi is also a kind of traditional exercise or treatment in China. So right now, more and more researchers try to see if Tai Chi could work for people with COPD. And apparently different researchers also found significant findings in improving exercise tolerance, balance, and quality of life after several weeks of practice. And of course, acupuncture has also been used in the management of a problem. And Accutane is also a non-invasive method to stimulate the acupuncture point. All these also have been shown to improve the exercise tolerance, reduce the breathlessness, improve the quality of life for the patient. So in future, we really want to have more collaborative work so that we can work together and work with the involvement of patient, involvement of supporter, healthcare professional, and physician to see what we can do for better living with COPD and do more for the people. So acknowledgement of my friends, and here are the references, and thank you.